aortic aneurysms, which plainly speaking are when the major artery to your abdomen ruptures.
Well, it's a silent condition, and unfortunately, most people don't know it's going to happen until it happens. And the conventional treatment for those ruptured arteries is typically major surgery.
But today, there's a new procedure on offer, one that's minimally invasive. To tell us more about it is Associate Professor Peter Robles from Singapore's National University Heart Centre and Mr. Lam Shong Lim, who's had the procedure done on him. Very good morning to you both.
Good morning.
Dr. Robles, let me start with you. I mean, abdominal aortic aneurysms, it's quite a new concept to me. It has very few symptoms. Is that why it makes it dangerous or difficult to diagnose?
Yeah, it's a silent condition and is usually picked up by chance. But in the UK and the US, it's still one of the top 10 causes of death in men over the age of 65.
What are the telltale signs, if any?
Pain is one of them, back pain, abdominal pain, some unusual symptoms like feeling pressure in the abdomen, or sometimes feeling faint, feeling pain in your legs, so on. But most of the time it's silent.
So when it actually happens to a patient, how do they know it's happening to them? And what are the symptoms when they actually feel it?
If it's stretching or tearing, they describe it as a tearing kind of back pain, very severe, may cause them to collapse or faint.
When it's symptoms like that, back pain, abdominal pain, we have those kind of cramps once in a while. When do you know it's time to seek medical advice, and how do you detect it early so that you can have early treatment?
Some countries offer screening for this. So if you're over the age of 65, an ultrasound scan, which is quite a painless, non-invasive way of looking at the organs inside the abdomen, can be done. It's just a one-off scan.
But what are some of the things that lead up to such a condition?
Well, smoking and high blood pressure are some causes. Some have hereditary causes. And a lot of times it's just, part of growing old or aging, unfortunately.
Mr. Lam, what was it like for you? How did you come to, look for a doctor and realize that you have the condition?
Oh, well, then I was in Perth playing golf. After the game of golf, I find myself short of breath. It happened that a good friend of mine is a medical doctor. He sent me for a checkup, and then they find my aortic aneurysm is 7 centimeters big.
7 centimeters big. Well, Dr. Robles, maybe you can explain to us how it was like for Mr. Lam.
So this is a glass model of aneurysm. You see the bulge here. So Mr. Lam's was 7 centimeters, which is about 3 times the normal size. So in order to repair this, as you said, in the past we would have to open the patient and sew in a new blood vessel. But now we would just put in a stent like this through the leg arteries to seal the swollen artery.
Why is this method considered better than the conventional method?
Well, the risks are lower. It's keyhole surgery. You don't have to open up the patient. You can also do this under local anesthesia in some older and frail patients. And the recovery is quicker. The return to activity is much quicker.
For example, does it shorten the procedure as well? How long does it take, and what's the recovery period
the
like?
procedure is probably the same time, 2 to 3 hours.
Okay.
It's quite a complex procedure, but the stay in hospital is probably half of what you would have for a normal open procedure.
Now, you just mentioned that it can be a complex procedure. So what are some of the risks involved in such a procedure for the patient?
Well, the main challenge is to get this placed accurately with precision, because you want to maintain flow to the kidneys and the gut and to the legs as well. So the 3 pieces have to be placed inside the body. It's almost like building a model ship in a glass bottle, and you have to get it right.
Is everyone, eligible candidate for this kind of procedure?
Unfortunately not. About 50% of our patients have the right anatomy for this. Those that have, very twisted or crooked arteries are not quite suitable for this.
And I'm just wondering, is this condition only susceptible to men, or is it across the board?
It is much more common in men, but women do get this as well.
Well, this minimally invasive procedure is relatively new. Mr. Lam, when you heard about it, what was your first concerns?
Oh, when I heard about that, certainly I feel very frightened. because I had my triple bypass done before,
Right.
which was open heart. So luckily now you put the stents in, so I don't feel any pain at all whatsoever.
And after the, after the procedure, did you feel any discomfort or?
Yes, a bit of discomfort, a little about that, but not critical, not as bad as the open heart surgery with my triple bypass. Frankly, Pro have done a very good job for me.
Doctor has done a very good job. How is it done? I mean, it's minimally invasive, but you still need to put the, I don't know, your tools in to fix the area. So do you like stretch the skin, bloat up the area, or?
No, we make two small punctures in the leg arteries,
Right.
and remotely we place these stents over wires, guide wires, and sheaths in the body, and put these three things in.
How long would the procedure take?
A standard case would be maybe 1.5 to 2 hours. A more complex case where we would have to build in branches and so on may take 5 to 6 hours.
How does it become complicated? I mean, when you say we put in branches and all that.
Yeah, so if some people where the stent has to be customized, for example, and you have to build in branches for the kidney arteries or some of the other important arteries in the body, then you have to place these quite precisely. It does add some time to it.
So what happens after the surgery? What are some of the things that you follow up with the patients, in their recovery process?
Well, they need regular follow-up, maybe 6 months, just with an ultrasound or CT scan, just to make sure everything is going well.
What was the recovery process for you, like Mr. Lam? I mean, how soon before you could go about doing your usual routine and activities?
Oh, after our discharge from the hospital, it takes me only about 3 or 4 weeks. It's not compared with the bypass I've done. We take a long time to recover.
Peter, let me just ask you this. Can people prevent themselves from getting such a condition? I mean, what are some of the things that they should do, and do they go for regular checkups to make sure that they're healthy?
Yeah, I think smoking is the #1 thing they can, control in their lives. But once you've had it, it's better to detect it early and get it seen to. Some patients have small aneurysms, and all they need is regular follow-up, regular checkup. So if it grows to a size maybe 5 or 6 centimeters, then it's worth treating that before it ruptures, because then it will be too late.
I mean, we've spoken about how this affects older men, but can this condition also affect younger people?
There are few younger patients with this, but these are hereditary conditions where the connective tissue in the body is weak, and it tends to, make these blood vessels grow abnormally.
Well, okay, thank you so much both for coming in this morning and telling us more about this condition. We've been speaking to Associate Professor Peter Robles and Lam Shong Ling on how the surgical method is called EVA can save lives among very elderly patients suffering from abdominal aortic aneurysm.
And you're watching Primetime Morning right here on Channel News Asia. We're heading for a short break, but we'll be right back in just 2 minutes.
Thank you.